Welcome back. Here with us on Urban Debate on Mirror Now, the Indian Council of Medical Research, ICMR, has issued a new advisory for COVID testing, detailing who should get tested after coming in contact with a COVID positive patient. ICMR has said that if you're not a high-risk contact based on your age or comorbidities, you need not get tested after getting exposed to a COVID positive patient. Now, this advisory is very different from what we had the last time around, during the second wave specifically. Now, we know that the mantra of the center is still be more aggressive in testing. But amidst that, why has this advisory come from ICMR? Let's understand from Dr. Samiran Panda, who is the head of Epidemiology and Infectious Diseases Department in ICMR. Dr. Samiran Panda, appreciate you joining us here on Urban Debate on Mirror Now this evening. Can you explain to us the rationale behind this new guideline for tests? Who should get tested? Who should not get tested?
Those who have certain symptoms, which could be indicative of COVID-19 or SARS-CoV-2 infection, we know that it causes respiratory tract infection. So if somebody is having, headache with fever and cough, sometimes it could even be a little bit of loose motion. And body ache. These are the symptoms which should prompt one to think that maybe I should get myself tested for SARS-CoV-2 infection. So anybody who is symptomatic and there is a clinical suspicion, one could even suspect while at home because these symptoms are now very well known to the common mass. So one could always, get prompted to do the test.
Okay, Dr. Panda, now, so you're telling us that asymptomatic contacts of a COVID positive patient do not really need to get themselves tested?
So anybody who is asymptomatic and, young adults or children who have come in contact with somebody who is symptomatic or who has come in contact with somebody who is confirmed positive for SARS-CoV-2 infection, they need not to get themselves tested. However, if somebody who is asymptomatic but quite elderly, like 60 year of age or above, and has some comorbidities, so even if they are asymptomatic, it is a good idea for them to get tested because early detection of infection in those who are elderly and who have comorbidities really help in terms of, the care and support provisions or the steps to be taken. So what I'm saying that those who are asymptomatic contacts of confirmed cases of SARS-CoV-2 infection or those who are asymptomatic contacts of symptomatic individuals, they need not to get tested provided they are not elderly, provided they are not having comorbidities such as maybe somebody is suffering from hypertension or diabetes or is a patient of cancer or getting treated for cancer. So these are the special situations. So we call them elderly who are at risk or at-risk individuals. So at-risk individuals, even if they are asymptomatic, but they have come in contact with someone in the family who is confirmed case or are symptomatic, it is good for them also to get tested.
So, Dr. Panda, to understand it simply, if I come in contact with someone who has tested positive for COVID-19, then I don't have to get myself tested if I don't have any symptoms as such, but I need to follow the guidelines that are there, for example, isolation guidelines or quarantine guidelines.
Yes, absolutely. So if you have come in contact with somebody who is symptomatic or who has been tested positive for SARS-CoV-2 infection, you may not get yourselves tested because you are not elderly or you are not having any comorbidity. But it is a good idea for you to separate yourself. The proper term there would be quarantine, because we use the term isolation when somebody is a suspected case or confirmed case and is being cared for at home or at a facility. So I would say that asymptomatic contacts need not to get tested, but they should separate themselves. They should go into a home quarantine thing so that they can monitor their health. Are they developing any fever? Are they developing cough? Or are they doing fine? So just keeping a track of their own health. They should do it by separating themselves in a different room or in quarantine. So that's the term which we prefer using. Isolation is for those who are clinical cases and they are being cared for. So that's the difference between these two terms. Isolation is for those who are confirmed positive or are clinically suspected cases and are being cared for. And quarantine is for them who are not a known case or known individuals with infection, but they need to monitor their own health in terms of development of fever or development of cough or any clinical symptom.
So then isn't there fear of these asymptomatic contacts actually becoming carriers? They may infect somebody else?
Well, when somebody who is asymptomatic and who is a family member of another individual who is symptomatic or a confirmed case, we think that, okay, this particular person might be asymptomatic, but he or she might be infected and he or she might spread infection to others. That's not actually a very well-placed logic, because for those who have never come in contact with any known individuals and they are roaming out on the street, a common man or a common woman on the street, they might not have anybody who is symptomatic or who is a confirmed case, but even then, they have a possibility of being infected, because most of the infections in SARS-CoV-2 remains asymptomatic. So the whole point is not having a symptom in an individual who has a family member or close relative who is a confirmed case are not the only individuals who can remain, infected and can spread it out. So that they should not be singled out. There are many individuals roaming on the street, because we know that the nature of the infection is such that 70 to 80% of the infections do remain asymptomatic.
So, Dr. Panda, is it because of the nature of the infection, Omicron infection specifically, that you've taken this decision that ICMR has decided to do this? Or is it because of the increase in pressure on labs that we are seeing in the third wave?
It is about the disease transmission dynamics. So we have gone through the two waves of the epidemic, and this is the third wave. And India has now been able to establish not only a very robust system of testing, system of care provision, not only at the tertiary care level, and different states have taken very important measures and steps to be able to offer care. And there is a platform called INSACOG. So we have fairly good idea about the relative proportion of the variants in different states. So all of these should guide and should inform the public health decisions. And that's exactly what is happening. So it has got nothing to do with the pressure on the laboratory and how do you dissipate that pressure. No. The whole point should be what is in the best interest of public health, what would help us to tackle the pandemic at its current stage. So it's not a stage which is uniform all along, and suddenly due to dissipation need of the load, there is a change in strategy. No. So the current stage of the epidemic and the infection, we call it force of infection in the community, or the way the disease has unfolded and the way the epidemiology is now, requires certain pragmatic and purposive public health strategy. And this testing strategy is serving exactly to that end.
So, Dr. Panda, now we know that Omicron is more transmissible but less severe as compared to Delta. Anything new that you can share with us about this new variant of concern and the way it is behaving?
Well, first of all Indian states are different from each other, and health being a state subject, each state should look into its own data to be able to graphically represent which wave of the epidemic a state is in. Secondly, the predominantly circulating variant, for example, in Maharashtra or in Delhi, would be Omicron. But that's not necessarily the case for each state. In some of the states, it would still be maybe 40 to 60% Omicron, but the rest is Delta. And in another set of states, one would not be surprised to see mostly Delta and a little bit of Omicron. So it's a mixed scenario. While we discuss about this wave, we probably should not use the term the third wave or the new upsurge in India. Because if we look into the data from Delhi, clearly it is a fourth wave one would be able to figure out. So that's point number one. So basically, the local data should be used for locally describing the epidemic properly, and the local state level scenario for the situation needs to be analyzed from that perspective based on the analysis of the local data. In terms of concerns, Omicron mostly remain asymptomatic, 70 to 80% of them. And those who cause symptoms, they are mild in nature, but we do not really know how the Omicron would behave in elderly or in those who have associated comorbidities. So the concern should be, for all of us, should be, how do we avoid super spreading events? So it is not just Omicron, it's a mixture of Omicron and Delta that is happening in many states. We know that Delta could create severe clinical feature or lead to clinical stage, serious in nature. And thirdly, we do not know when the large number of Omicron infections happen, even a smaller proportion of them affecting elderly or affecting those who have comorbidity might create quite a bit of pressure on the healthcare system. So I would suggest that we should be all remaining very cautious. We should avoid doing anything that could give rise to super spreading events. And from that perspective, avoiding mass gathering and avoiding non-essential travel would be very, very critical. We need not to go to Sri Lanka or Nepal or whatever for a pleasure trip now.
Dr. Panda, I also want to understand from you, why was it said earlier that whenever the third wave comes and hits the country, children are going to be impacted badly?
Got your point. So I'll talk about two things. One, yes, I'm aware of some of the apprehensions expressed in terms of the possibility of children getting infected and they becoming severely ill. And during those discourses, I highlighted that the fourth round of National Serological Survey, which got completed in July and August 2021 this year, this is 2022, so last year, July and August. During that National Serological Survey, fourth round, it was very clear that about 60% of the children were already exposed and infected because antibody presence was detected. So it's not that the children were not getting infected, and they got infected while the schools remained closed. So their source of infections were probably their adult family members. So it is not true that the children did not get infected. So the children did get infected, did get exposed, and they developed antibodies. And that was shown through the fourth round of the National Serological Survey. However, during that time, we did not see the children who got infected becoming severely ill. So those apprehensions were not well placed on data. The data clearly showed that considerable number of children were getting infected, but they were not falling sick or did not experience severe, suffer from severe clinical disease. And in terms of the vaccination, which is happening now, for the children belonging to the age group 15 to 18, I would call them adolescents. They are going to be adults. So their movement and their mixing is much more with the adult population. Their movement is also is much more compared to the younger children. So we have to have a pragmatic vaccination plan. And I think that by vaccinating children or adolescents who belong to this group of 15 to 18, we are covering an age group which has more contact matrix. The term is contact matrix. So who comes in contact with whom? And where is the chance of this coming in contact with each other is much more. So the vaccination decision has been guided by the contact matrix, the mixing pattern, going to the schools, 15 to 18, going to colleges. Some of them are in some other occupations as well, if they are doing some work in addition to their studies. So all of these actually helped in coming to this decision.
Dr. Panda, lastly, before we let you go, what is your assessment of the current wave that we are witnessing across the country? Last few days, there has been a slight dip in the daily case count as well across the country. Do you see it as a ray of hope or just the weekend impact?
All right. So I'll say that we actually did a mathematical modeling, which is from ICMR in collaboration with the Imperial College. And now it is very well appreciated by the Minister of Health and Family Welfare. And there is a great level of acceptance, the policy making level and programmatic level of this, the model, mathematical model, which has performed far better compared to some other models. It has its uniqueness. And based on this model, we have developed a simulator. We call it chromic simulator. We are in the process of fine-tuning it. And by applying that model, we have realized that there might be a huge upsurge of infections, but that might not necessarily lead to huge upsurge of severe cases. So that's good news. And again, that upsurge of infections will not also necessarily lead to upsurge of cases in the hospitals, which might require oxygen or might go to ventilator. So these two things are also good news. So the good news is that it's a milder form of the disease, but the caution, the word of caution, that should also be appreciated, observed next to each other, next to this good news, is that not every infection now is Omicron. There are Delta circulating as well in some of the states. So I would say that, yes, there is a ray of hope, and we might start seeing this curve coming down very quickly, as was the case in South Africa. But we should not, or we cannot afford to lower our guards down.
Well, that's a very important point that you've made, Dr. Samiran Panda. Of course, there's a ray of hope, but we all need to be extremely cautious as well. Thank you very much for joining us here on Urban Debate on Mirror Now this evening. With this, we are slipping into another very, very short break. Stay with us.